Ozempic and Wegovy have both been praised by celebrities and social media influencers because of their related weight loss successes, but there are some risks to consider. This video is going to cover why staying active is crucial even when medication's in the picture. I'm Dr. Elise Brown, and I'm a scientist who studies how exercise can help prevent and slow the progression of diabetes. Weight loss medications first kicked off in the late 1800s with thyroid hormone medication, but the side effects were too grim. Then in 1933, 2,4-DNP was introduced, but this was soon taken off the market after several related deaths. We then tried amphetamines, but there were addiction issues. Then came the rainbow pill, which combined amphetamines with other drugs, but this was soon also taken off the market because of several related deaths. Phentermine was introduced in 1959, and no other drug has been prescribed more than phentermine for short-term weight loss purposes. Then in the 1970s, people started using fen-phen, but there were cardiovascular issues associated with this drug. Since the 1970s, there have been several other weight loss drug raves, but Ozempic and Wegovy are the current fad. First things first, Ozempic and Wegovy, they're the same drug, sumaglutide. Ozempic is the lower dose of the drug, and it's FDA approved for people with diabetes. Wegovy is the higher dose of the drug, and it's FDA approved for people with obesity and other health issues. The drug class they fall under is glucagon-like peptide 1 receptor agonists, which is chemically similar to a hormone that our body produces naturally, GLP-1. Translated to English, these drugs help to lower blood sugar by causing the pancreas to produce more insulin. They also suppress appetite, they increase feelings of fullness or satiety, and they slow down digestion. Most of the side effects with these types of drugs are linked to gastrointestinal issues like stomach pain, but there's also the risk of developing thyroid tumors. Now that we have an idea of how these drugs work, let's talk about weight loss. A concern with any weight loss program, especially when we're talking about losing large amounts of weight, is the loss of lean mass. Lean mass is going to be a combination of muscle mass and organs. In a large drug study called the STEP program, 140 research participants took weekly doses of Wegovy for 68 weeks. At the end of the study, the average weight loss was about 15% body weight. Now, of this 15%, about 18.5% of it was fat, and about 11.5% of it was lean mass. That's almost 12 pounds of muscle and organs gone. This is especially important in type 2 diabetes because more muscle tissue means a greater ability of the body to be able to clear extra sugar out of the blood. Regular strength training coupled with an appropriate amount of dietary protein is going to be the best approach for trying to spare lean tissue during a weight loss period. Even though this approach hasn't been studied enough with Ozempic and Wegovy, a diet with a protein intake of 1.2 grams of protein per 1 kilogram of body weight a day. So if you have somebody that weighs 150 pounds, that means they're taking in about 82 grams of protein a day. This, coupled with regular strength training, has been shown to preserve lean tissue mass during a weight loss period. Many times people associate the need to exercise with weight loss efforts. So if we've got a drug that loses the weight for us, we might ask ourselves, what's the point in exercising now? It's important to keep in mind that these drugs are not going to improve our cardiovascular fitness, which is critical for heart health. They're not going to improve our muscular strength, our lean mass, or our bone mineral density, which are all vital to physical functioning, strong metabolism, and decreased fall risk. Now, it may be true that somebody who is taking weight loss medications may not need to exercise as much as somebody who is trying to lose weight without the medication. However, for health benefits, it is still important that we still all get in at least the bare minimum of the physical activity recommendations. So that's 150 minutes a week of moderate intensity physical activity and at least 2 days a week of strength training working all major muscle groups. If you're currently taking weight loss medications, speak with a healthcare professional and come up with a plan that includes strength training and an appropriate protein intake. While these drugs might seem like miracle pills for weight loss, it's important to make sure that you're losing the right type of weight. Thank you for watching.